Hello, welcome to episode 3 of the No Normal Show for Thursday, July 9th, brought to you by Revive Health. This is our weekly deep dive into how hospital and health system marketers can navigate what we're calling the no normal. I'm Jeff Spear, Executive Vice President of Strategy at Revive Health, and your host for today's show. I'm joined by Chase Kleckner, Senior Marketing Manager at Revive Health, and our show's producer, the man that makes everything happen. Hey, Chase, how are you?
I'm doing well, Jeff. Good to have you on the show.
Good to be back. Good to see you. And we've got a couple of my favorite people here, Catherine Brick and Peter Garlinghouse. Catherine is Vice President of Client Experience and Strategic Partner for all of our clients across marketing communication. She spent a lot of time in DC, has a strong corporate communication and public relations background, and really, really great to have her here today. Catherine, nice to talk with you.
Hi, thanks for having me.
And Peter Garlinghouse, or Pete G, as we sometimes call him, he's Associate Media Director of Vive Health and responsible for putting together our and executing strategic media plans to help us reach our client goals. So Peter uses lots of tools and channels and pretty much any kind of data source you can think of to figure out how to target people and get the most out of our media bucks. So before joining Revive Health, Pete spent 8 years in New York City working on media for a variety of accounts, including American Express, NBC, Macy's, and AstraZeneca. Hey, Peter.
Hello. Thanks for having me.
Thanks for coming. So we get two guests plus Chase today. It's going to be a great episode. We're going to talk about Facebook boycott and a little bit about corporate activism. But before we get into all that, stick around, please. If you're new to the podcast and wondering what we mean by the no normal, we mean that there is no new normal because we don't know how long this is going to last or whether it's months or years. I think every week something occurs and we know that you can't really rely on what happened before, nor can you necessarily try to predict too far into the future what's happening. So we're living in the state of no normal for hospitals and health systems. And we're trying to be here so we can share some stories and trends, some research, and really just continue what we've been doing with previous podcasts in helping you think through things as much as possible. And really not just to survive, but really try to thrive. And that's definitely our mindset of optimism during all of this. So as we move through the show, please use the question queue in Zoom to line up your questions, and we'll get to many of them as possible. You can also use the chat function if you'd like to talk to other attendees. But if you'd like Catherine, Peter, Chase, or I to answer a question, please put that in the Zoom queue, the Q&A queue. We'll also provide a few links in the chat so you can access those immediately. And finally, please remember you can subscribe to the podcast on iTunes, wherever you listen to podcasts. And we also put episode archives on our website, thinkrevivehealth.com/COVID-19. We've already had a few episodes. Actually, this is the third, I believe, of No Normal. Last week, great one with Paul Matson of Cleveland Clinic. And the kickoff with our CEO, Brandon Edwards, really good as well. So if you haven't listened to those, please check them out. Okay, so those are some of the disclaimers. We do want to start with a couple quick updates. First, it's been about a week and we've now passed the 3 million mark of confirmed cases and have experienced more than 132,000 deaths in the United States because of COVID-19. Really staggering numbers. I think for me, sometimes I kind of lapse into glossing it over now. It's just like daily news. So it is important to stop and just internalize that for a minute, absorb it. But kind of related news to the number of cases over the past week, President Trump has come out blasting the case count and the significance of that. His point of view has been that the testing, the number of testing just leads to higher case count, and that makes us look bad as a country. But even today, there was a news story from NPR that a representative in Ohio went a step further and said to stop testing, telling all of his constituents to stop testing because of the number of tests and number of positive tests leads to what he says I believe, just a way for people to get controlled. he wants people to slow the testing down. He said it's being used for giving the government excuse to claim something is happening that is not happening at the magnitude they say it's happening. Now, the governor in Ohio has said, and the other public health officials have told people to wear masks and distance and all that. But this is very important, I think, and very relevant because it puts hospitals and health systems in a position that they may not be used to being in, which is you're in direct opposition, and oftentimes with an elected official here, in what you believe is right and is maybe your responsibility. And that's part of what we're going to talk about today. And last week, Paul Mattson of Cleveland Clinic, so from Ohio, did talk about the number of public safety messages and advice that have been getting out. I think he quoted about 130 million impressions on social of their content. Now, I'm sure there's a variety of things, but certainly some of that was about how to stay safe, masking, distancing, and things like that. So when you hear something like that, Catherine and Pete, where you've got an elected official saying, don't get tested, this is an excuse to claim something's happening is not happening, and you're a hospital and health system is clearly having to take responsibility for people's safety, and of course still worried about supplies and capacity. What's your take on the situation?
Yeah, I mean, it's such a fascinating time to be a part of the marketing and communications for hospitals and health systems, and really never more important. And I feel like as we've been working with clients, the work has never been more meaningful. And that's because of the ability to get those public health and public service messages out there. It is a difficult situation to be in when you're going up against an elected official. At the same time, those elected officials are going at each other. So you're going to have to choose one side or the other at some point, or have a perspective. And where your community is relying on you is to show up with the information that will help to protect them. And that also helps to build the trust with that community as well, so that you can continue to serve them and serve them well. So it's a really difficult one, but I think as we'll get into today also, as we talk about the Facebook boycott, it's all about what is real for you as an organization, so you can be authentic to that voice and be, be committed to the community that you serve.
Yeah, I feel like leadership coming out and to kind of be bashing testing is wildly irresponsible. This is a global pandemic. I don't know how it turned into a right wing versus left wing thing, but it comes down to science. If we were to come out and say, hey, do less STD testing, yes, the number of reported STDs out in the country would be much less, but I promise you the actual number would be much higher. So I just think health systems need to be on the side of science here. There's no political ideologies when you're talking science. There's just, this is right, this is wrong. So I just feel like when leadership comes out and gives these mixed messages, it kind of just feeds the flames of divisiveness.
Yeah, and that's, I think, what we're going to talk about here. We're going to talk about Facebook boycott, but I guess underneath that is, what is your stance as an organization, and really evaluating how you use your voice and your resources and your dollars, and that is now becoming something of more scrutiny. I think the testing and the masks, and what we're seeing also now is the turnaround time on testing, the availability of testing is also, again, a big issue, which then becomes a public health issue. So hospitals and health systems have voice, they have weight, they have credibility. Do you get into that and work with people to say, we need more testing, we need to have it more widely available, and we need the turnaround time faster, even if then you might get put on, I guess, a microphone from a elected official who thinks differently. But let's get into Facebook. So at this point, I'm sure everybody's heard of the Facebook boycott, but you may not have been paying that close attention to it. There's so many things to watch and to try to keep track of. It is hard to get into detail on all of this, and that's why we're here. and have people like Catherine and Peter who've really authored a paper actually for us on our team. But basically, Catherine, give us an overview of the Facebook boycott, where we're at today, and then let's get into some questions.
Yeah, sure. So I'll give a little bit of background for how this kind of started and then what has happened since then, since we are amidst the boycott now. It started on July 1st. More than 750 advertisers have now joined on, and they are requesting really better monitoring and policing of misinformation and hate speech on the platform. A very small number are including other platforms like Twitter, but really it's focused on Facebook. Most of the other platforms have done something related to misinformation and hate speech. There's Twitter hid the infamous President Trump speech about when the looting starts, the shooting starts, as incendiary and inciting violence, and they've fact-checked tweets on election fraud. But over time, really, Facebook's CEO, Mark Zuckerberg, has said that social media platforms should not be policing political speech. He said on Fox News just a month or so ago, "I just believe strongly that Facebook shouldn't be the arbiter of truth of everything that people say online." So they have leaned into the freedom of speech and have not elected to censor hate speech and misinformation. So that's where the Stop Hate for Profit boycott comes in. Civil rights groups like the Anti-Defamation League, the NAACP, and Color of Change have asked brands to halt spending on Facebook. It's really been particular so far to July for paid advertising, but we're kind of intrigued by where this could go from here. And some of the brands that have joined on have been pretty significant: Unilever, Coca-Cola, Verizon, Best Buy being among the most notable. Also mission and cause-focused brands like Patagonia, REI. But there's a lot to kind of look into here as far as how effective it might be, and we know that health systems have joined on as well. So what does it mean for their brands? So a little bit about what's kind of happened since then. Initially, Mark Zuckerberg and Facebook have come across as pretty non-committal. Zuckerberg said, "I'm committed to making sure Facebook remains a place where people can use their voice to discuss important issues, because I believe we can make more progress when we hear each other. But I also stand against hate and anything that incites violence or suppresses voting, and we're committed to removing that no matter where it comes from." So they have announced some minor changes. They've committed to adding more context to problematic political posts, so if a post is violating Facebook's rules, but it's coming from an important political figure, such as President Trump, then it will get a label deeming it newsworthy enough to remain. So it wouldn't be hid, it would just be labeled. And then it would also attach labels to posts on the subject of voting to direct users to accurate voting information through its voter information center. And it has also broadened its definition of what hate speech is. And then just some updates from this week. Facebook, both Sheryl Sandberg and Mark Zuckerberg met with the Anti-Defamation League, NAACP, and Color of Change. They felt that they were getting lip service from Facebook. They said they clearly thought that they deserved an A for attendance to the meeting overall, but that there really nothing had changed. They didn't feel like they were getting the attention that they needed. And then just yesterday, Facebook released a years-long audit of its civil rights policies and practices that they had taken on at the urging of civil rights groups. And that audit is pretty damning about the need for reform and the problematic ways that it handles issues like hate speech, election interference, and algorithmic bias. So that just came out yesterday. We don't know whether or not that will inspire Facebook to change. And I think something we might want to talk about a bit is just the both kind of financial impact and social pressure, what might inspire change. But as of right now, I think that the boycotters are feeling like they haven't quite been heard yet.
Right. So we want to cover this. There's so many things that I think about here, but I want to confirm something that Catherine said. There's clearly big brands that are boycotting. And there have been some hospitals and health systems that have done this too. So we're going to spend some time today talking about considerations if you haven't thought about this yet, on whether or not you do it or don't do it, broader implications of that. But first, let's just get to the bottom line on what's the reach and impact of pausing Facebook in your marketing efforts, and which right now, we've been talking for months, marketing and awareness and engaging consumers is extremely important to what you're doing right now to try to recover. So while we're trying to think of that and still trying to possibly consider boycotting Facebook, just in sheer numbers and reach, Peter, can you talk to us about that, what that means?
Yeah, this is a huge hit, this boycott to advertisers. You know, obviously it's making a dent to Facebook, but their foothold in the social media space cannot be overstated enough. When it comes to your media plans, your reach potential is the name of the game. You want to get your message out to as many people as possible. And with Facebook, right now, about 70% of all adults in the US are Facebook users. That is a huge number. When you look at the next closest one, that's Instagram at 37%, which also happens to be owned by Facebook. So you'd have to move all the way down to, you know, the Twitters and the Pinterests and Snapchats. Those are all around about a 25% reach. So there is a huge drop off by taking Facebook off of your plans. And it's one of these things, it's not as easy as just redirecting your funds into a different channel or using a different social media space. You know, they're almost too big to bully. So it makes it a lot more challenging for us as media people. There's also efficiencies that tend to get lost. You know, when you start looking to make up for that incremental reach that's being lost by moving away from Facebook, you have to start looking to other larger channels. Because when you're talking about a 70% reach with adults, that's on par with traditional channels, things like print, TV, radio. Those things are costly. They have a high out-of-pocket cost. So if you're going to look to those in order to make up for the reach that's being lost, it's gonna come with some higher out-of-pocket.
Yeah, that is just tough call to make here, because at a time when hospitals and health systems need to reach people the most, even in some of the reasons we talked to the opening of the show of purely for public safety, we're also talking about possibly cutting off maybe our most effective way to reach people. Okay, so that's a big question out there. Let's go back to now, let's consider this as a brand and less so as a reach, or the bottom line here. Catherine, what do you think brands or hospitals, health systems specifically need to consider if they're going to make this decision to join this? And I will just throw out one thing. I think that Stop for Hate was initially said, let's do this for 30 days. But it's very possible that this could go on and pick up steam even more so than it is today. So what do you think should be considered here?
Yeah, I think that you're 100% right about that, Jeff. There's a lot to consider because there are so many unknowns. We don't know if there's no action by Facebook, will this be indefinite? Would coming back online on August 1st, look pretty disingenuous? Are you willing to stop your organic posting as well on Facebook or extend that to Instagram, right? There's a lot that's involved in that. And that's why really the number one part of your decision needs to be about that authenticity to the brand, because what are your values and practices? Those are the things that will persist beyond just this month and that you'll be living by. And that authenticity to how you show up in the market and to the perception that your consumers and patients have will go a lot longer, right? It has a greater impact and will have a longer tail, and will help you to also just be, authentic to yourself and your values. So really, as we've been counseling clients, that authenticity to who you are as an organization and your brand is the number one thing that we've been talking about. Have you been, I think that there's something consumers can kind of sniff out if you're not really truly the brand that you're pretending to be. And so have you already been talking about issues related to misinformation or even to diversity, equity, and inclusion, to Black Lives Matter? Have you been talking about anti-racism or health equity? If you've been bold in those things on social media and in thought leadership, then this may feel like the right thing to pursue. It's also important to know where your internal team members are and where they're, how they're thinking about things, or if they're posting things that are either in alignment or not in alignment, as well as your consumers and patient population as well. But it all kind of comes back to that. Is your brand synced up with this? And so we think that for, you know, in the long term, the important thing is to have that perspective already kind of baked, so that when these decisions come up, should we join a boycott, or should we, you know, should we be participating in a protest or supporting it? You've already kind of got that value system down. So those are a few things to consider about whether or not to join it. I think there are risks with both. There are risks to join, there are risks not to join. People will question why you are or why you aren't, no matter what. So you need to know what that perspective is. And if you choose not to join, there's also assumptions that people will make about you there too, and make about your brand.
That's for sure. There's no doubt about that. But I think the consistency in action and in what you say and what you do is at the heart of a strong brand that is being tested more now than ever for a lot of companies, but definitely for hospitals and health systems, because they generally haven't had to weigh in a lot of political issues, and very much can be, there's of course the financial stuff that comes with certain things, but for the most part, it's been pretty clean. Peter, do you want to talk a little about, okay, what are the risks if you join in here, and could hospitals and health systems actually help make a change with Facebook if they believe in this?
So I think what you need to do is look at Facebook from a big picture perspective, just to kind of understand, you know, will this movement, even if it gets everyone on board, will it do what it needs to do in order to get them to make the changes that everyone's asking for? And the first thing you need to look at is kind of the structure of their leadership. It's very unique versus what we would see from, you know, pretty much any other company that we might be going after. The operation is entirely led by Mark Zuckerberg. He exercises complete voting control over the company, and he can't be removed by shareholders. So this is something that kind of complicates the entirety of the boycott campaign, because when you're trying to hit him where it hurts by impacting the revenue stream,
right,
it's less about that, and it's just more about what he wants to do. And, you know, there is kind of a precedent with him that, you know, if he doesn't think that's best for the company, he's not going to do it. He doesn't, you know, he doesn't care what else is going on. Something else that also needs to be taken into account is just how large that revenue stream is. Right now, I think about 1,000 total advertisers have joined this boycott. 40 of those are considered, it's a huge number, and 40 of them are considered big brands. So they actually fall into their top 100 advertisers in terms of their yearly ad spend. So it's definitely a lot. It sounds like a lot. But when you take a look at the numbers, the revenue model, it's so large and has so many participants that even if all 100 of their top advertisers pulled out, it would only account for about 6% of Facebook's advertising spend.
Wow.
You know, so, you know, they don't want to lose money, but as much as Facebook needs the advertisers, we as advertisers, we need Facebook a lot more. You know, they're almost too big to bully, as we keep saying. And you know, just kind of anecdotally, I used to work on one of these large brands that joined the boycott. And I was texting a friend of mine today, who's the director on the social media account. I mean, first of all, he's very bored right now because there's not a lot going on. But just second, based on the conversations, he does not see this extending past July. Okay. They rely on them way too much for their bottom line. It's what moves the needle. It is a huge, it's an ROI driver. So he really doesn't, even though they've kind of made, I'm not going to say what account it is, but they have made a statement that they are willing to sit out for the year. He does not see that actually happening. one thing that people also point to is, in terms of thinking that maybe the boycott is doing what it needs to do is, they point to the stock price. It plummeted on, I want to say in June 26th, there was about an 8% plummet in the stock price on that one day. And everyone kind of pointed to that and said, wow, this is doing the job that it needs to do. They're taking notice. Shareholders are going to take notice. That rebounded almost immediately. Right now, Facebook stock price is higher than it was a month ago before all this started. So they don't have to give in to this public pressure. They can wait it out as long as they want, and they know that advertisers need them. So it puts us as advertisers in a tough place.
Sure does. Sure does. Okay, so here we are. Maybe you're considering joining, maybe you're not sure, but what do we think we should do, I guess, to avoid being reactive in a situation like this as it comes up, or as they're assessing even this particular situation? Catherine, how do you think they should be looking at this?
Yeah, well, and I think going back to really just the conversation right now, consumers and patients right now are really looking for someone to trust and some certainty, and the voice of hospitals and health systems is more important than ever in order to, to have that trust and to be able to put out important messages. So to your point, the consistency and authenticity, again, of those brands is really, really important. So having a strong point of view for your organization on diversity, equity, and inclusion initiatives can help you to make those decisions in the future. Once you have that decision and perhaps a pathway to make those decisions, then you can meet those questions as they come up. So one consideration is to have potentially a task force that's ready to respond and make decisions about this, to reevaluate what your stance is, to discuss what you're ready to speak on and with what volume, so that you can be sure that you're consistent about what you stand for. I think there's something to, making those decisions in a smart way, because also if you stand for everything, then you stand for nothing. And if you make a really big splash suddenly about something, then people will ask, well, why that? Like, why did you choose to, suddenly take action in the Facebook boycott when you haven't participated in XYZ things before? So making sure that there's a rationale behind those decisions and that it is true to your brand is really important. And picking those issues that really seem to be aligned with where your brand is going and what your mission is will help you to do that as well. So that's all part of what could be in that task force and in that POV in order to address these kinds of topics in the future.
Yep. And we wanted to talk maybe a little bit later about a specific issue that's headed our way related to vaccines and who gets vaccines when they're available, because they certainly won't be available to everybody. But we'll save that for the end as something that our listeners need to put on their to-do list. So maybe it's a way to keep you around for a minute. But Peter, okay, let's say that we've got some listeners right now that have joined or are planning to join. They've thought this through. How do they fill the gap now in trying to reach people and drive ROI?
So it's a very loaded question. First of all, I would say, I congratulate you on joining the cause. Personally, I think it is something that needs to be done. It's something we had to address at a larger level. But it's not something that you can immediately just say, all right, we're going to take the funds that we're going to Facebook and we're going to put them into something else. You're not going to be able to make up for that reach that's being lost without spending more money than you were before. So, you can attempt to build that same incremental reach through those already existing digital channels, but that will also come at a huge price tag. So it's really not as simple as just redirecting the funds. My background is completely as a media strategist. So my job is always to kind of take a look at the overall plan at a high level and kind of figure out how all the channels can work together in order to achieve whatever the campaign goals are. And one of my primary tasks in that role is to look for ways to protect my clients' dollars. You know, I want to make sure that every dollar is accounted for and we're being as efficient as possible. So while I say this should be addressed on a campaign by campaign basis, I would say 9 out of 10 times my reco during this period, if you are going to join the boycott, would be to just take a hit when it comes to losing that Facebook reach. You know, just kind of sit this one out, keep the dollars on the side, and when this is all over, you know, you can enter back in the space. You know, you have the luxury of knowing that your competitors are probably in the same boat as you, and you also have the knowledge that you know both parties, both the advertisers and Facebook, want this to end as soon as possible. It's just honestly, it's probably advertisers probably more so.
Yeah, I think that makes sense, Peter. I'd also advocate for this is the perfect scenario for why hospitals and health systems need to invest in the MarTech stack. They need to get their own engagement and direct reach with consumers. They need to have some loyalty marketing programs going, and never underestimate the value of earned media and what you can do there. I think it's a lot of times we just go straight to advertising and paid. And of course, there's all kinds of reasons to do that, but there's lots of ways to reach people. So look at your entire mix of how you're reaching people, and make sure you've got healthy channels all over the place. Let's talk about authenticity a little bit, because then I think it will kind of get into the topic we want to get into, which is, this is one small example, but the bigger topic is corporate activism and where do you stand on that. But before we get into a little bit of that, let's talk about what it means to be an authentic brand, and what health systems or other healthcare organizations need to consider. Catherine, you want to talk a little bit about your view on that?
Yeah, well, I think that it does kind of broaden beyond just this Facebook boycott, right? Like, as you are looking ahead to all of the continued Black Lives Matter movement and conversation across the landscape and other social justice pieces, if you're considering a bolder stance on that, if your point of view is going to be more outspoken, then there's a lot to consider about what you might need to go forward to think about, considering your hiring practices, who's in your C-suite, vetting your partners and vendors for their commitment to diversity, equity, and inclusion. Some of the academic medical centers that we work with have police forces for their university. What are your policing practices? And just in considering your own legacies as well. There's a lot of our hospitals and health systems have long histories, and they're not always perfect. And so acknowledging that and talking about it in order to move forward and be able to heal from that is also something to consider. And that would give you, taking some of those steps and taking the actual actions will help to give you that kind of platform where you can truly, be authentic with an outspoken point of view on social justice initiatives. But you have to live it. So that's something we talk about in branding all the time, is that it's the full perception of you is every touch point, every experience that anyone has with you and your brand. And it can't all be done by marketing, although we can help. So taking all of that into consideration can help you to be authentic if that is the pathway that your organization is looking down. And there's more too, right? And we can all, every organization is going to be different and have different considerations that we can help to think through. But it is a holistic direction for the organization to take, and not just something that would be lip service,
right,
which you will get called out for.
Yeah. And Peter, how does ad placement factor into this part of the discussion beyond just whether you're going to join a boycott or not?
So this is kind of it's almost a bigger topic in itself, but I'll try and cover it off very quickly because I know we are at time.
We've got some time. Okay.
But there's a bit of a hidden agenda here within this boycott. Obviously we all agree Facebook needs to do a better job in controlling hate speech on the platform and just limiting the disinformation or fake news, as our commander-in-chief likes to say. But at the same time, from another perspective, advertisers are kind of using this boycott as a way to kind of pressure Facebook into giving more control of the platform. Traditionally, it's a very walled garden. They will not allow a lot of things that wouldn't be acceptable with most other advertisers. You know, for instance, you know, when you run with the just regular digital display ads, a lot of times you can blacklist your ads. So you can make sure that, hey, if I'm running, I used to work on an airline account. I don't want to be in any news sites where they're going to be mentioning a crash, or if they're going to be mentioning violence or terrorists, things like that. You don't have that option with Facebook. You're kind of at their mercy for where they place your ad. Nobody wants their advertisement to be next to some sort of hate speech or something that doesn't align with their values.
So maybe an ad saying stop testing next to your ad saying wear a mask.
And then next thing you know, your brand is getting associated with that message, even though that was never your intention. A big part of this problem is that Facebook doesn't allow third parties onto their site. They're kind of checking their own homework, you know, so they come in and they claim that they are already moving about 90% of hate speech or problematic content. There's really no way to check that because they don't allow third-party audits on their site. You know, whereas typically when you run a digital campaign, you can have a third-party source like a double verify or a moat, and they can confirm that your ads are running as promised. They're not running alongside any problematic content. You don't have that option with Facebook. So this is something that's being used right now by advertisers to kind of push them on this. And I think that is something we need to get to because they do need to be a little more transparent. And as advertisers, we want to know that our dollars are being spent the right way, and we're not going to be misrepresented.
It's an important point, and maybe one that our listeners can incorporate into whatever stance they take on the issue, in talking about why they believe some change needs to happen. And I think it's very defensible. I think one thing, you know, we'll kind of wrap up a little bit. This is the No Normal show, and we've talked about Facebook. Who would have thought we'd been here? But really, this is this bigger issue of corporate activism that probably was seen as kind of a dirty phrase by a lot of people a few years ago. I think a lot of corporations would shudder at that thought. And whether you believe in it or not, it seems now in the No Normal that companies are getting forced into a position in some ways on taking a stance in some issues. The public pressure that is out there, as well as some big companies, Catherine mentioned earlier, Patagonia already have a history of doing this, Ben and Jerry's, but then there's others that are joining in for a variety of reasons. And right now, I think hospitals and health systems are going to be at the center of that for two reasons. Number one, so many of the issues are related to health that we're talking about today. And second, whether you view yourself as a leader or not, most health systems are, if not one of the biggest employers in their region. So with that, and top line revenues is huge, even if your margins are slim. So with that becomes more scrutiny and probably pressure from others around you. And one issue that we see coming up that we absolutely advise our clients to get ready for is hopefully the rollout of the vaccine. Today, the New York Times ran a story talking about an advisory committee that the CDC and has put together, that been working on since April, about how to roll out a vaccine when it's ready, because the main issue is that there will not be enough vaccine ready immediately for everybody to get the vaccine. And so they will have to prioritize who gets the vaccine. And this might bring shades of when the COVID first started happening, and in Italy, where people had to talk about, well, who would get a ventilator? And that was a really difficult discussion. And luckily, I don't believe anyone in the United States has had to quite face that. Got close, I think, in New York, but seemed to have averted that. But the vaccine seems like it's almost certain that we will not have enough, and that we will have to decide who gets in line. And the CDC and several experts weighed in and said, well, essential workers first, hospitals and health systems, those that are treating people, those that are extremely important for the health of and the running of our country. So there may not be a whole lot of argument there. But then you get to another layer about who should get the vaccine. Should it be the most vulnerable? And if so, who is most vulnerable? Unfortunately, right now, statistics are very clear that minorities, particularly Black and Latino populations, are 3 times more likely to be infected. And so, given the times and the discussions of racial justice and disparities in care, the article and these experts rightly are deciding, will race come into play here on if we're trying to give the vaccine, if you're going with that priority of who's most vulnerable, well then do Black and Latino populations go to the front of the line? And I don't think we need to probably acknowledge how crazy that kind of sounds to a lot of people and what kind of debate and issues that may cause in your communities. If you are in a community that already has a lot of divisiveness or has large populations of Black and Latino people, then this is going to be an issue you face. If you are in a community that maybe doesn't have that issue, there's probably still going to be resources, and then who gets that vaccine? So while we may have people now saying, I don't want to wear a mask, I'm okay with being out freely, I guarantee you that when the vaccine comes out, they will probably want to be in the front of the line. So Catherine, Peter, do you have any thoughts about this and what our listeners should be thinking about here?
Yeah, I mean, I think it just goes back to being prepared for those kinds of things that you can predict for, and then also creating something that can be, I mean, frankly, the transparency piece is going to be a difficult one here, and because it is such a difficult subject, but there may be a process or an index that you can use to say, this is what, what our decision making will be in order to help our most vulnerable. And again, it needs to be aligned with what you've decided as your point of view.
Yeah, Peter?
Yeah, there's been a lot of difficult conversations we've been having to have this year just with everything going on, and it's only going to get more convoluted as we go on, but it's something that we need to navigate together with our clients and make sure that we kind of have a united front.
I agree. This one is tricky, but I gotta say, you have to think about this now. And Catherine mentioned earlier, we always think, of course, about consumers and the public, but this also has real implications on your internal workforce and what you're saying and what you're doing and how they see the leadership and the decisions you're making, which are critical to the success and thriving for any brand. You've got to have your internal team's hearts and minds, not just other people. So I would say right now is the time to really think about what kind of organization you are. Are you a leader overall, not just a healthcare leader, but are you a leader in your region? And if so, what does that mean to your organization? And having very explicit conversation with your leadership about these things. Who are we as an organization? If so, then what do we do in these kinds of situations? Let's discuss that in detail. Let's make some commitments to each other. And let's get some input from our internal people and make sure they know it, so that when we do decide to take a stand or don't take a stand, it is not a surprise to them. If you've got people right now that expect you to boycott Facebook and you're not, of course, it'd be much better if these kinds of discussions were had earlier on what your principles are and what you would stand up to publicly or not. Same with earlier, we just dealt with this. A lot of systems had to, in the moment, decide to make a comment about lives matter. Not a comment, do we do something? Are we gonna promise changes in the future or not? We're not telling you what's right or wrong. We're telling you, though, that you need to have a strategy and a plan in place and then stick to that, because consistency is key, as Catherine said earlier. So get this in place, decide what kind of organization you are, get your internal people talking and being very explicit, but also particularly with this issue coming up with vaccine development and rollout, make sure that you're talking to the community leaders as well. And you can't do that early enough. We are in July, and it seems like COVID started a year ago. That was only 4 months ago, but we're about to hit elections. So the public discourse is going to get crazier, then the vaccine's going to come out. And if you can involve elected officials, patient advocates in your community, businesses, of course, and talk to them now about how you are preparing and how you want to help ensure the safety and the success of your community, then when this comes out and you're taking a position and you're giving your thoughts, it's not a surprise to anybody and you've got some support. It's always a lot to do, but definitely got to get ahead of things. So
Very well put.
thanks. I think with that, we can probably wrap. I want to thank Catherine and Peter so much for joining us. Really always thoughtful from these two. And you may have not met them before, but hopefully you will soon and maybe have them on again. Really great people here at Revive Health and just a wealth of knowledge. So thanks for coming.
Thanks for having us.
Yeah, thank you.
And next week, we're scheduled to have Dr. Adon from University Health System, who launched and oversees UH4U, which is a program designed to provide practical, compassionate support for university hospitals, 28,000 employees in the wake of COVID-19. I'm sure we have a lot of listeners right now that would be extremely germane to and relevant. That's something that gets lost is your job, as we said earlier, with thousands and thousands of employees and how you can be supporting them and keeping them doing their best. So please don't miss that conversation, as Dr. Adon will provide practical learnings that we can leverage to make workforce mental health a priority within your organization. Definitely important. And remember to visit thinkrevivehealth.com COVID-19 for recording of today's episode and everything else. Chase, thank you as always.
Yes, glad to. Thanks for guiding the conversation today, Jeff.
It's been a pleasure. Really important work you all are doing. Keep it up. Let us know how we can help and be good to each other. So until next week, good luck out there in the no normal.